Have you noticed that I hardly end my health videos? I hardly end my videos without a proper reminder to parents or guardians on the need to always take their child or children to the hospital to go see a doctor when they are sick. Have you noticed that? Trust me, it is not what you think it is. This one reason behind this practice will blow your mind. It's also a wake up call to somebody, to the people that will be watching this video. So if this is what you are so much interested in knowing, be sure to keep on watching. This one reason is because of what we call the physiological reserve. Hold on, don't skip and don't scroll. I will try as much as I can to explain this to you. You see these two words? Physiological reserve is the reason behind this practice that you have seen me maintained in this channel. Now, before going into explaining to you what physiological reserve is, I want you to understand something. First, what comes to your mind when you hear the word reserve? Like, what other word, what synonym comes to your mind when you hear the word reserve? Save, right? Okay. Keep. Save, keep. Take, for instance, I want to reserve this for you. I want to save this for you. I want to keep this for you. Having that at the back of your mind. Now I'm going to explain to you what physiological reserve is. Physiological reserve is said to be the ability of your body makeup. What are your body makeup? Those things that make up your body, which are the cells, the organs, the systems, and the tissues. They are the things that make up your body. And this your body makeup work together in providing your body with what your body needs in keeping you alive. Now, physiological reserve has it to be the ability of all this your body makeup to work beyond their normal working ability. Like, it is the ability to work extra in providing your body with what your body needs in keeping you alive and strong when you are under stress or when you are sick. You get it? I have a lot of things to say about this physiological reserve, but if I should start saying it, I might end up confusing you. But what I want you to understand about these two words is that in a simple term, in a short term, physiological reserve is like a backup power. It is a saved power, a reserved power, a kept power that the body falls back on. The body uses to compensate when your body is under stress, when it is under stress. So now the main thing I want you to get there is that in an adult, this physiological reserve is high. But in children, in pediatrics, this physiological reserve is low. So because of this reason, when a child is severely ill, that child can deteriorate very fast. That is why I encourage parents to always take their children to the hospital when their children is sick. Do not try to measure your child's health with the same yardstick you use in measuring yours. I mean, it is better you take that child to the hospital, have the child examined, properly examined. Let the doctor tell you that your child is fine. At least if you're going home, you will be going home with your peace of mind. Then you staying back home thinking that all is well with your child, whereas a lot is going on with your child. And before you know it, they will start telling you stories that touch the heart. It is not our portion, but they say that wisdom is profitable to direct. The question is, how do you know when a child is severely ill? Unfortunately, you almost don't know when a child, especially a neonate, infant, like newborn babies or infants that are children that are like less than 1 year, or children that cannot communicate well yet. Most times you don't even know when they are severely ill. Most times you don't. Unlike in adults or adolescents can communicate easily to you how they feel about something. If they are having pain, they can tell you, I have pain here. If it is radiating, they will tell you it's radiating to this place. This is where I'm having it now. This is how I feel. I have headache. They can easily communicate. At least helping them will be very easy. But with children, you don't even know. A child might be severely ill, you would not know. Sometimes when children cry, especially newborn, when they cry too much, the first thing parents take it to be is that the child is hungry, or the child has gas in their stomach, or the child or the child wants to poo, or the child pooed. They'll tell to check the diaper, you get it. Or even with children, sometimes they cannot tell you, Mommy, this is what has happened to me. Mommy, this is So what I want you to know is that most times in children, when they get to the point where you will start thinking or start noticing that that child is severely ill, just know that a lot has happened in that child's body. And surviving whatever situation he or she is at that point will be under probability. I will explain further with a true life story. This story my friend in Nigeria told me that in their hospital, a woman brought in her child due to the complaint of cough. And she said that when the woman brought the child, that the woman was giving the complaints like it's just a normal thing. She was like that the baby had cough, and the way she was saying it, she took it as something that is unserious. Okay, but then my friend said that on looking at the child, you will notice that the child was retracting here, like this place was going in. So the child was taken in for proper triage, like proper assessment. And what's the shock there is that when the child was assessed, everything was normal. The child's temperature was normal. The child oxygen was at 100%. Blood pressure, everything was normal except for that retraction. So they were like that maybe the child might be choking. So they tried doing one or two things to know if, and nothing happened. The child was still okay. And the child, but because of that retracting, she said no, that she would take the child straight to the doctor for proper assessment, for further assessment and diagnosis. She said that the distance from where they got the child assessed to the doctor was just a minute and a half. And immediately they got to the place where the doctor will have to assess the child. They reassessed the child vital signs again. You know the thing that happened? Under a minute and 30 seconds, this child's oxygen level, oxygen saturation dropped from 100% to 75%, and immediately it became an emergency case. Thanks be to God that the child was resuscitated. But let us think about it. Let's assume that this child was not brought in the time the mother brought him to the hospital. Only God knows what would have been the fate of that child if the mother did not bring that child at that time she brought the child. So you see, to her, the child was okay. It was just ordinary cough. And she was not wrong. But even when the nurse assessed the child was vitally okay. The only reason why she took that child to go see that doctor was because of that retraction. But when looking at the child was okay. But just under a minute and 30 seconds, the child's case became an emergency one. So this is what I am trying to say about children having low physiological reserve. And because of this, when they are severely ill, there is every probability that that child will deteriorate very, very fast. There is every probability. So if you can, please stop hesitating when it comes to your child's health. With children who cannot communicate well, with children, you need to be very careful. Very careful. These children are vulnerable. They are vulnerable. What I want you to know is that most times in children, when they get to the point where you will start thinking or start noticing that that child is severely ill, just know that a lot has happened in that child's body. And surviving whatever situation he or she is at that point will be under probability. That is why it is best to always do what? Take them to go and see a doctor. You know why? Because the hospital setting has everything. They have the equipment, the tools that can easily and in a fast pace assess a child and tell you this might be wrong with this child. If they are not sure, a lot will start happening. They'll start running labs, doing some diagnostics to diagnose that child immediately. At least the child's survival rate will be high than when the child is at home under your mercy, because you may be thinking that the child is fine. So please make it a habit that when you see your child feeling some kind of way, okay, I always say after 1 or 2 days, that is for people that are not severely ill. Maybe you think your child is having cough, flu, maybe treatment, just home treatment, like for 1 or 2 days is okay. I prefer 1 or 2 days if there are no serious complications. If the child is not getting better, then go to the hospital. But if there are serious complications attached to those things, my brother and my sister, there is no need waiting for a day or 2 days to pass before going to the doctor. Get up, take that child to go see the doctor, to avoid stories that touch the heart. So when you see me hammering on this, just know that this is the reason. This is my reason of always reminding you to take our little angels to go see professionals when they are not feeling fine for proper treatment, diagnosis, and assessment. I hope this video is helpful. Please, you might want to share this video with somebody out there. Somebody needs to see this video. If you think it is helpful, do not forget to like, share, and comment. I'll see you in my next video. Thank you very much. Bye.